Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science. Today we are going to discuss a topic about the basics of genitourinary system from the subject nephrology. So what are the major functions of kidney? That is what we are going to see here. It is a defined part because we are talking about the genitourinary system, that is mainly for the kidney, ureter and the urinary bladder. So the major function is it filters the blood, it produces, stores and excretes the urine, it supports for reproduction, and also it helpful for the each and every waste to be removed from your body. And the urinary tract, various parts together will be connected to form an urinary tract where the kidney, ureter, bladder and urethra forms the structure you can see in this image. And the reproductive integration is a vital organ for the holistic care, and this reproductive organ is also an integrated part along with the urinary bladder and the pelvic region. So what could be the ideal locations of the kidney is, the kidney is located in the back side of your body, which is a retroperitoneal structure from the thoracic 12 to lumbar 3. This is the exact placement of the kidney. And the right side kidney will be slightly lower compared to that of the left side kidney. This is because of the presence of the liver on the right side. So the kidney is always protected by a fat capsule and a fascia, which is called as renal fascia. In this image you can see the poles of the kidney. It has an upper pole and it has an borders, surfaces where it is the major center area of the kidney is called as hilum, where the major arteries and veins will be going inside and coming out. And what could be the size of a kidney is about, it is 11 cm long, 6 cm wide and 3 cm thick, and the hilum is for the vessels and the nerves to enter into the kidney and leaving out, and it is protected by a fat capsule and renal fascia. The weight of the kidney will be about 150 gram in males and 135 gram will be in females. So what could be the interior structure or a microscopic structure of a kidney is the nephron, which is called as a functional unit of the kidney. So the kidney have a major two layers, which is called as cortex layer and the medulla layer. The cortex is an outer of the glomeruli, and the medulla will have a center part of the kidney where the pyramids and columns are present. The nephron is about 1 million of nephron will be present in each kidney, and the parts of the nephrons will be glomerulus, tubules, loop of Henle, collecting duct. And the internal structure of the kidney have a calyces, pelvises and a funnel shaped structure for collection of urine, and the ureter will be start coming from the kidney. This is the major structure. So you can see the structure of a nephron here, where it is fully capsulated with the capillaries, which is covered with the capillaries. How this is the structure of a kidney. So when you cross sect the kidney, you can see the two layers what I have explained on the previous slide, which is the renal cortex and the renal medulla. So here in renal cortex, which is the outer layer of the heart, it is located just below the capsule, which is the covering of a kidney, and the Bowman's capsule, glomerulus, proximal and distal convoluted tubule are located in this part. And the renal medulla, which is the inner part of the kidney, which is about 10 to 12 dark colored pyramid-like structures will be present, and the base is for the cortex and the apex of the kidney to meet together and open into a minor calyx. So what could be the other parts when compared to that of kidney is the urine is collected from the kidney and it flows to the ureter, which is a slanting it's a tube-like structure which is 25 to 30 centimeter and in an S-shaped manner. It is coming from the renal pelvis and it's connected to the urinary bladder. So urinary bladder is a muscular sac which is fully made up of muscles, and it has a capacity to hold your urine for up to 400 to 600 ml of capacity, where the urinary ureter will be entering into the bladder. The area is called as trigone, which is a triangular area which is present on the bladder. So the muscle supplying for the bladder is the detrusor muscle. It have a capacity to extend, it is stretched and it can relax. When it is in relaxed and without urine, it will be in a tetrahedral shape, and when it is in bulging shape or it is filled with urine, it will be in an oval shape. So the blood supply will be in visceral arteries, which is supplying vesical artery, which is supplying to the urethral and genital parts also. So here you can see the structure of a male urethra. So in male urethra, which is totally different from that of female, the parts of the male urethra are testis, epididymis, ducta deferens, semivesicles, prostate and the urethra. The urethra called as a penile gland, the penis part, which is about 18 centimeter of long, and it can the both pathway for the urination as well as for an ejaculation of the sperm will occur in the same pathway. You have a spermatic cord through an inguinal canal. and the prostate gland surrounds the prostatic urethra. And in female urethra, the structure is totally different, and it have a very short urethra. It has a vaginal part also in the genital area, where you can see the ovaries, uterus, vagina, and the urethral orifice between the vagina and the clitoris is located. And this is another structure of the female. Actually, it is an additional structure for a female. And you can see a cross-sectional image where you can see the sacral bone, rectum, uterus, and you can see the urinary bladder here over there. For the male, you won't able to see the structure, and it's only structure of that genital part along with the urinary part will be present. In lymphatics, you can see the sacral and iliac nodes will be present here. The blood supply of the kidney will be defined as a renal artery, where this renal artery gives a minor branches or the small branches, which is called a segmental artery, intralobular artery, arcuate artery, and the interlobular artery, or the various forms of the arteries present, so that it will be having a microvascular structure, circulation to the kidney, so you can able to give the flow of kidney. So what could be the major disorders? You can see at the end of learning this genitourinary system actually as a basics is, you can see the UTIs like urinary tract infection, cystitis, stones, and benign prostatic hypertrophy, renal failure, cancers, or other forms of disorders which can commonly occur in the genitourinary system. And the symptoms which occurs, the major symptom is a dysuria, there is no urination, or anuria or hematuria, that is the urine with the blood, or the urinary incontinence, that is leakage of the urine from the urinary bladder, which is occurs very involuntarily. These are the factors that are the common disorders you can see under the urinary system. So at the end of the summary, what I am describing here is, we have seen the structure of a kidney, which is a bean shaped, and it covers by a renal fascia, and it has a two layers, actually outer layer which is cortex, and the inner layer which is medulla, and you have nephrons, which is about 1 million nephrons in each kidney, and the urine will be collected in a proper area which is called as renal pelvis, and from the renal pelvis it goes to the like ureter, and ureter to the urinary bladder. This is what the sequential appearance will be. Thank you for listening. Hope you have understood this topic well.